When people start noticing hair loss, they usually face a tough question. Should I go natural with oils, supplements, and lifestyle changes? Or should I go medical with proven treatments like Minoxidil, Finasteride, or even a transplant? Both sides promise results. Both have loyal believers. But what actually works and what's just hype? Let's break it down based on science, results, and real-world data. Hair loss is complex. It isn't caused by just one thing. It can come from genetics, hormones, nutritional deficiencies, scalp inflammation, or chronic stress. That's why there's no one-size-fits-all treatment, and why some people see results from oils, while others need prescription medication. The truth is, both natural and medical approaches can help, but in very different ways. Let's start with the natural route, the one most people try first. Hair is made of protein, mainly keratin. To grow strong, it needs enough iron, vitamin D, zinc, and biotin. If you're deficient in any of these, your follicles can literally pause production. So, if your diet's poor or you're on a restrictive plan, your hair may thin, not because of genetics, but because your body's missing the building blocks it needs. Now, let's talk about oils and natural ingredients. Rosemary oil, in a 2015 clinical study, performed as well as 2% minoxidil after 6 months of use, with fewer side effects. It improves circulation and has anti-inflammatory effects. Pumpkin seed oil also shows promise. Studies suggest it can block DHT, the hormone behind male pattern baldness. One 2014 study found a 40% increase in hair count after 6 months compared to placebo. Caffeine, saw palmetto, and peppermint oil also have mild stimulating effects on follicles. Lifestyle matters too. Chronic stress raises cortisol, which can push follicles into a resting phase called telogen effluvium. This leads to sudden shedding a few months after stressful events. So improving sleep, reducing stress, and supporting scalp circulation all help maintain growth. The takeaway? Natural methods strengthen your foundation. They help prevent further loss, improve texture, and keep your scalp healthy, but they usually don't reverse advanced baldness on their own. Now let's move to the medical side. Minoxidil is one of the most studied hair growth treatments in the world. It works by improving blood flow and extending the anagen growth phase of hair. Around 40 to 60% of users see visible results after 4 to 6 months. The downside? Stop using it and regrown hair often falls out again within months. Studies show it stops or reverses hair loss in over 80% of men, especially at the crown. However, it's not approved for women, and it can cause side effects in a small percentage of users, like reduced libido or mood changes. Dutasteride works similarly, but is even more potent, often used off-label for stubborn cases. Beyond medication, there's microneedling, rolling tiny needles across the scalp to trigger healing and improve absorption of treatments. Some studies show combining microneedling with minoxidil leads to up to 4 times better regrowth. Then there's low-level laser therapy, the laser helmets you've probably seen online. They use red light to energize follicle cells and increase density over time. Clinical data shows modest improvement after 6 to 12 months of regular use. Medical options are more potent, but they require commitment. Consistency, patience, and tracking are key. Here's where most people go wrong. They pick one side and ignore the other. But in reality, the best results come from combining both. If you only use minoxidil but ignore scalp buildup or iron deficiency, you're limiting progress. If you only apply oils but never address hormonal causes, you'll plateau. Here's the real challenge. Hair grows slowly, about 1 centimeter per month. That means you might not see visible improvement for 3 to 6 months, even if something's working. That's where tracking matters. Traditionally, dermatologists use photos and scalp scans, but lighting, angles, and camera quality can make results look inconsistent. Now, tools like MyHair.AI make this easier. You upload scalp photos, and AI measures your density, bald spots, and regrowth over time. It helps you see whether your plan, natural, medical, or both, is actually delivering results. No more guessing, no more placebo effect, just data. So, natural versus medical, which delivers results? Natural methods build a healthy foundation. They're safe, gentle, and help prevent further loss. Medical treatments deliver stronger regrowth for genetic or advanced cases. They're backed by science, but need consistency and long-term commitment. The best results come from combining both and tracking progress along the way. Because hair doesn't grow overnight, but with patience, data, and the right plan, improvement is possible. So before giving up, understand your cause, mix science with self-care, and use tools like MyHair.AI to stay on track. Because what you can measure, you can improve.